Today I'm going to talk to you about PCOS, what it is, and how to improve and even resolve it. So, my name is Dr. Tom Rofrano, founder of the Natural Medicine Clinic in Palm Beach Gardens, Florida. And over the last 34 years, I've had the opportunity to see over 100,000 patient visits, many of whom have not only gut and thyroid issues, but hormonal imbalance. So when we run lab work, it comes back, and oftentimes we see the hormonal imbalance, which describes PCOS. Well, what is PCOS? That stands for polycystic ovarian syndrome, and the components are irregular menstrual periods or no period at all, menstrual cramps, excess male hormones like testosterone, for instance. And thirdly, polycystic ovaries, where the ovaries become filled with fluid-filled sacs called follicles that surround the eggs, and the ovaries can then swell up and really cause a lot of issues. So if you have two of those three things, then you can be diagnosed with PCOS. So irregular periods, excess male hormones, or polycystic ovaries. Some of the symptoms, which are a lot of PCOS, are, again, irregular or no menstrual periods. Menstrual cramps are a sign, as well as PMS, and even infertility. It's one of the most common causes of infertility. And increased male hormone features, such as increased hair growth on your face, back, chest, and then hair loss on the head, and then oily skin, acne. These are all signs of excess androgens or male hormones. Excess sweating, anxiety and depression, weight gain, and other hormonal issues, like it's often involved with thyroid, hypothyroidism, as well as thyroid nodules, Hashimoto's. This is an autoimmune thyroid condition. On top of that, we're looking at what are the underlying causes. So the main number one cause is insulin resistance, which we'll go into in a few minutes how to address all of these. Insulin resistance, what happens is then that can lead to increased testosterone production from the ovaries, thus causing all of these symptoms over here. And other hormonal imbalances can be involved too, like increased DHEA, that's an adrenal hormone. It's also an androgenic hormone. And prolactin's another hormone that could be too high, luteinizing hormone. It's also maybe a genetic component. So, and to take it a step further, I like to look at, well, what's the underlying root causes of some of those things? So when we do an evaluation, we'll do comprehensive labs that checks for these 5 different areas. So deficiencies are an underlying root cause. For instance, we often see deficiencies of iron, B12, folate, magnesium. Vitamin D is a really common deficiency that we see because vitamin D is involved with, it's a prohormone, so that's really important for that, as it is for regulating insulin. Toxins we check for, so environmental toxins like too many plastic compounds. We also check for heavy metals, as well as other components. Under infections, we'll often see Epstein-Barr virus or gut infections. So most always, women that come in with PCOS have digestive issues, gas, bloating, IBS. So when we run testing on that, we often find bacterial overgrowth, yeast, candida overgrowth, parasites. Hormones, again, besides the hormones we mentioned, we also, what's often involved is adrenal dysfunction. So stress can cause your adrenals to cause some imbalances over time, either excess cortisol, which is the stress hormone, again, excess DHEA, or your cortisol could be depleted from just too much stress over a long period of time. And then lastly, food reactions. So almost every patient that I have seen, which is a lot with PCOS, has a gluten sensitivity, and that is a real driver of this. And it's often involved with this whole insulin resistance thing, which we'll get into. So gluten is the main one I find, and there are other foods as well that are commonly involved, causing food reactions, thus causing inflammation and driving this whole thing. So those are the root causes. And then this particular, but I'll just describe you a particular patient I saw, and then we'll kind of go over in detail what we did with her. But she was a 36-year-old female who came in for thyroid nodules. As you know, PCOS is often involved causing thyroid issues. So she came in for that. She also had PMS, bad menstrual cramps, heavy periods, infertility, and prior miscarriages, excessive perspiration, anxiety, depression, fatigue, acne, aches and pains, headaches. So after doing a thorough evaluation and putting her on, the main component of our treatment plan is what I call the free diet, because in her case, she was gluten sensitive and she was reacting to other foods. But this diet, it's not just free of gluten, but free of gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So it's free of all those commonly allergenic foods responsible for inflammation and these chronic digestive and other health issues. So we had her on that, along with the appropriate supplements, which I'll describe to you shortly. And 4 weeks later, when we rechecked some of her lab work, her testosterone dropped from, well, it cut in half. It was in the 42 to 22. That was in 4 weeks, so it was in the normal range. Her DHEA, another androgenic hormone, cut by almost 100 points to normal levels. That went down. Her estrogen dropped by almost 100 points to normal. She had estrogen dominance. Her progesterone went up by a factor of 10, and her ferritin dropped almost 100 points to normal, which was a sign of insulin resistance. And her inflammatory marker, one of the best things about this, went from 57 to less than 1. That's her C-reactive protein. So dramatic reduction in inflammation, which really drives this whole thing, this whole insulin resistance, inflammation. They just really drive so many different chronic health issues, and this being one of them. So the whole purpose around the diet is to really reduce that inflammation and insulin levels to allow you to heal. And the difficulty losing weight part, well, despite trying so many other things, she dropped 20 pounds. That was in 8 weeks, and went from like a size 12 to a size 4 within 2 months. So that was, she was thrilled about that as well. And just to kind of contrast, the traditional treatments for PCOS are birth control pills, metformin, which is like a diabetes drug, along with spironolactone, which is a high blood pressure drug. And then even there's a surgical procedure, laparoscopic ovarian drilling, that they sometimes will do if the drugs don't work. So that's traditional treatment to help manage symptoms. And then the functional root cause treatment, I call it. Well, we started again with the free diets, which, by the way, if you would like a copy of the free diet phase 1 food chart, I'll make sure I put a link below so you can click on that to get your free copy. And that we also did what I call our functional 5 supplements. That's our multivitamin, fish oil, vitamin D with K, magnesium, and probiotic. And this particular multi has nutrients, high levels of nutrients like chromium, vanadium that help also with blood sugar regulation, and which is important for insulin resistance. We also add extra zinc, and inositol is can be really helpful for PCOS. And we use the Myo and D-Chiro combined inositol form. That's been shown to be really helpful. Berberine is another supplement we use. The one we use is called cardiometabolics because it has berberine and alpha lipoic acid. With those combined, help really support healthy insulin levels. And then methylfolate is another common, methylfolate B12. Those are commonly deficient. And so we use that as well, which can help. And all this is based on what someone specifically needs, because someone also may be iron deficient. Someone may need some other nutrients that they're low in. And as far as dosage, it's the same thing. Someone may need, say, 10,000 units of vitamin D, whereas many people only require 5,000. So it really depends on the fine tuning on your individual case. But generally, this is what we use as a foundation. And just know that just because you have something like this, even though you do the research online and they say there's no cure and you're just gonna have to live with it, actually just know that for this and really most any chronic health condition, if you really identify the underlying root cause, you can often be provided with real permanent solutions to help you get better. So thanks for joining me today. If you'd like a free copy of the Pre-Diet Phase 1 food chart, we'll put that link below. And if you would like to subscribe to my channel, just go ahead and do that. This way you'll get early notification of new videos. Thanks again, and we'll see you soon.